Welcome to the ANEW Body Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogrammed Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. And Chantal Donnelly, physical therapist and author of Settled, How to Find Calm in a Stress-Inducing World. Here at City Club Los Angeles, we follow our guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Body Insight Podcast. We are back for the second half of our episode with Chief Sexonista and Intimacy Coach Tiffany Yelverton at City Club Los Angeles. It's so good to have you back.
Thanks for having me back.
Tiffany gave us some background about her inspiration to become a sexonista and how this led her to be a leader and innovator in her field. We are ready to learn more.
Hi, Tiffany. So good to have you back.
Thank you.
So you've spent about 20 years learning from top sexual medicine practitioners. What are some of the most surprising or transformative insights you've gained about human sexuality and sexual pleasure during those 20 years?
I think the biggest things that I've learned is the importance of the pelvic floor and how that plays into our sexual well-being and our sexual pleasure, and just all of the sciences that and techniques that there are now to help overcome dysfunction. We kind of touched on last segment that, you know, with arousal for women versus men, and for women, arousal really does start in the brain, and for men, it starts with blood flow to the genitals, so it's very different. Mm-hmm. There's just so much to learn. I'm in a sexual wellness and menopause course right now through International Society for the Study of Female Sexual Health, Women's Sexual Health, and it's an organization I'm a big part of. I love it, and there's always new things coming out.
Yeah.
And new things to learn and new science. But, you know, I think they just discovered the whole clitoris in 1995 or something like that. So there's always new things to learn.
What do you mean they discovered the whole clitoris?
Well, because it's not just it was the first time that the whole clitoral glands and bulbs were actually mapped out, and besides just the little bit that we see on the outside.
The one that, yeah.
There's a whole system inside.
Aha.
So interesting. I'm a physical therapist, and I work with a physical therapist who is a pelvic floor specialist. She and I share a space together. And so I'm always learning from her a lot about the pelvic floor. And she sends me a lot of the stress patients who a lot of it is tied to what's going on in the brain, and for women in particular, right? She treats men and women. But I work a lot on calming the nervous system for her patients who then go see her with the pelvic floor stuff. And the two of us combined can actually have a lot of progress, make a lot of really good meet goals for patients. It's been great. Yeah.
Pelvic physical therapy is amazing.
It's really come around in the last
Describe
decade or
that
so.
for the people who don't know what that is.
Well, a pelvic floor physical therapist is going to treat incontinence or constipation or prolapse or a lot of different issues that women can have. They can also treat men through a different hole. And they actually put gloves on, and they will go in and they will check for tension in the pelvic floor. They will look at scar tissue. They will look at the ability of the pelvic floor to contract and support, right? That pelvic floor supports a fair amount of organs. And so it's a really important area of medicine. And I'm sure you've talked to tons of physical therapists who work in that field. I'd be interested to have a conversation with you about it on the side.
Yeah, absolutely. I work several of them. I work with lots of different ones that carry my products in their office. We do workshops together. We we've taught at Chapman University together, things like that.
For the people who may not have access to a pelvic floor physical therapist or, somebody who specializes in that, do you have a suggestion for how they can, strengthen their pelvic floor? Just an exercise that they might be able to do at home on a regular basis?
Well, I think we've all heard of Kegels, but most women do them incorrectly. I train doctors, sometimes even gynecologists, how to teach their patients how to do a Kegel correctly. There's different devices that you can use also if you don't want to just do the Kegel yourself. But a lot of times it's the tension in the pelvic floor, and that we don't need to do Kegels. We need to actually relax because we're so stressed out in our society that we're holding a lot of tension there, and especially men hold a lot of tension in their pelvic floor. And that actually are the muscles that hold up an erection as well. So it's important for men to do Kegels as well.
So describe that. Tell somebody how, if they're just listening to this, how can they do Kegels at home?
So you want to sit and take all of the tension that you can out of your butt, your thighs, and your stomach. And you want to do it on a solid surface. You can imagine that it's the muscles that you clench to stop urine from coming out. But you want to really not do it while you're sitting on the toilet because you're not supported there. Your pelvic floor is not supported. You want to be in a supported system. And then if you imagine from your tailbone to your pubic bone is kind of what we're going to be exercising, and they're 3 layers deep. And then there's also one that goes from hip bone to hip bone. We're going to focus on the ones that are just front to back. So you can imagine if we've got a zipper from your tailbone, and that you close the zipper up to your clitoris, and then hold it. And then you can even imagine that there's a string on your clitoris pulling up through the middle of your body. And then release it out like you're unzipping. And it's just as important to unzip as it is to zip up, because then you're really relaxed. If you don't, it's like doing a bicep curl without exercising the tricep.
Wow. Okay.
You can tell when I'm doing it because my eyebrows go up.
And you can just start with a set of 10, 3 times a day. If I say do them before each meal or when you're sitting down to each meal, that's a good time to do it.
Yeah.
Pilates is really good for strengthening the pelvic floor too. So
it's that whole core area. We've got this cylinder that in our body that when we breathe and then it pushes down on our pelvic floor. Our pelvic floor holds everything up, and it gets a lot of workout, and it gets a lot of damage from childbirth and being on our feet and exercising, weightlifting, jogging, all those things.
So we got to tighten it up in there. Well, you are involved in a ton of organizations with a lot of different acronyms, including the Women of Sex Tech. That one I'm really interested in. Tell us about some of these organizations, NAA, SAS, STEM, PFSM. How do they enhance your work? What do they bring to the table for you?
Well, it's lectures, it's community, a couple that I'm in now that aren't even listed here that I do a lot more with actually now. But like some of them kind of went away during COVID. We used to have in-person meetings now we have a lot more Zoom. Women of Sex Tech is more of the technology side of whether it's virtual reality or toys or different apps that can enhance sex. And they're worldwide. So,
well, what are the ones that weren't mentioned that you are involved with now?
So now I'm a big focus I'm getting ready to launch crowdfunding in a couple of months, in 6 weeks actually, for Sexy Survivors, which is our platform to support female cancer survivors with intimacy and body love after treatment. And so I'm in a national organization of women in sexual health and cancer. And then I'm in ISHWISH, which is the International Society for the Study of Women's Sexual Health.
Wonderful. How did you get involved with Sexy Survivors?
I met a lady years ago when I was first networking and doing my company, and she was a 4-time cancer survivor, stage 4, long time. And she ran a lot of survivor groups, and she said after money, sex is what everyone's concerned about, getting back to normal, and no one talks about it. Mm-hmm. And she encouraged me to do something because of the way that my demeanor, I guess, and my education on all the sensate touch really comes into play too with cancer survivors, and loving their bodies and feeling comfortable after a body altering surgery or treatment.
Oh yeah, sure. After a mastectomy or something, that's going to be a big deal. Absolutely. So during your workshops and your events, you really aim to make the world a sexier place. What does a sexier place look like to you? What is that to you?
Where women are standing in their sexual power, who they truly are. And you can see the lights come on when that happens. To see women in my classes and courses come back into a week later and say, I had my first orgasm, I'm 45, and that was the first one, or 75 or 80 sometimes. And to just see the change that it makes in their posture, even, they show up different in the world.
I bet. Yeah, that's amazing.
And when you know, even when you're just like we did the little sensate touch activities of just touching, and that elevates your oxytocin levels, which you can't really be angry or upset. It just lifts you and you show up different in the world. Your skin is better. You have a healthy glow. All the health benefits alone, the stress relief from an orgasm is pretty amazing.
Well, how do you help people take away the shame? Because I think that that's something that's really ingrained in most people. They're not taught to talk about it. They were taught to keep their legs closed and wait till marriage and, do, in the old-fashioned times, do what the husband wants you to do. How do you help women erase the shame around sex?
I use several different modalities. One of them is EFT, or tapping, an emotional freedom technique.
We love these things.
I teach my clients how to write their own scripts, and we look at where it's affecting them in their body, what's coming up when they think of different things, and we clear those out pretty quickly. And then just the logic of, is this really what the Bible says, or is this what a man says from the pulpit? And to really just realize of the power that we hold in our sexuality and our sensuality, and that it's yours to own.
I think this is really important too with people's relationship with food. This is what I help people with a lot, is removing the shame that is centered around food. And I actually think that these two things are connected, because we're supposed to, in quotes, look like, a supermodel. We're supposed to, shun food. And eating is a sensual pleasure.
Exactly.
And when we divorce ourselves from that, I think we divorce ourselves from our body. And therefore, I think a lot of people are not connecting with their body, either with food or sexually. So I think it's so important to help people, reconceptualize their bodies and reconceptualize, kind of the morality around food and the morality around bodies.
Well, and it's just, like you said, it's a sensual enjoyment. It's just, it's nourishing, just sex. I use analogies between sex and food all the time, because it's very similar of how we eat too fast, and then we don't taste, we don't enjoy things. When we don't appreciate our bodies, we don't want to be naked in front of someone else. We don't want to have sex with the lights on so you can see everything and enjoy it, because if you're worried about what your body looks like, then you aren't present in the moment to really be enjoying. Or if you're trying to cover up, or there's lots of things that you can do to minimize the things that you don't like. But one of the first activities I take my ladies through is having them stand naked in front of a mirror and telling their body how much they love it and every part of it, and appreciating the roadmap that's on our bodies because it tells where we've been.
I love that.
I love this connection between food and the pleasure and sensuality and obviously the pleasure there. One thing that came to mind, though, is that people often use food to numb and escape, and that you can also use sex to numb and escape. Have you ever worked with clients who that's their issue and they need to come back to the real pleasure of sex?
Yeah, sometimes they have watched too much porn, or they haven't had a partner for a long time and they have just been masturbating on their own and need to really come back to what it looks like to touch another person or to be present with another person as well.
I'm curious, have you found that people, especially since COVID, are a lot more hesitant to get into sexual relationships or to explore other people's bodies because of, fear of getting sick or anything like that?
I haven't seen that, but we did see a large influx of retail sales during COVID. Everybody was exploring a lot of things and having fun, which was good. They were having to stay home. They were learning new things. We sold a lot more courses and everything because people were comfortable with online learning.
Oh, that's great. I love that.
That makes sense. That makes sense. As somebody deeply involved in the sexual wellness industry, where do you see the future of sexual wellness and education heading in the next decade? What changes or advancements are you most excited about?
I'm excited to see more focus on female pleasure and less misogyny. In everything from products to advertising to social media, and having women, we're starting to see even on packaging and the different sizes of bodies and being more inclusive, which is really wonderful because we all are different. We're all unique, and there is such a broad scope of people. We need to make sure that everyone's represented.
Yeah, I really hope that actually does swing back toward that. I think, with the advent of the weight loss medications and things like that, and kind of going back to, this super skinny ideal, it made me very scared for the body positivity movement. And I do see, that there is kind of a backlash against that and trying to reclaim, that all bodies are beautiful. So I really hope that that's a part of, what's coming. Not to be punny, what's coming.
We love puns.
But how do you see the body positivity movement? How does it play within sex therapy?
Well, you have to be comfortable with yourself, and that, maybe my size or your size or, I feel the same way about the weight loss drugs. I see people using them I remember this happening when Fen was out way back when, is that people look unhealthy, that they, some people just need a little bit more bulk on them to look good. And, it makes your skin look better. You age less, I think, but... that you have to be comfortable with yourself. And I'm not going to say don't use it, but we still don't know all the effects of it either.
Yeah, I think...
and I think that the range of people and colors and sizes is one of the things I love about humanity.
Yeah, I agree with you on that. And
you had mentioned earlier you have people stand naked in front of a mirror. If they really have a hard time with that, how do you help them? Like, there's a period of time, right, in my life where I couldn't have done that. And I've grown since then, but I don't even know how I got from point A to point B, where I do love my body. So how do you help someone who just really hates their body in the mirror?
We do EFT, we do private sessions. One of my favorite memories is I do a retreat almost every year, and it's not the first day that we do the mirror exercise. We've done a lot of work leading up to that in the first couple of days, but I took women into the room to do the mirror exercise, and most of the women told me that they'd never felt sexy before that. That one woman, she wanted me to film it on her phone, and she said it was the first time she'd ever told herself that she loved herself.
Wow.
And she was almost 60 years old.
Wow.
And so it's not going to be just an overnight thing that you're going to love your body, but once you start touching yourself and learning about your body and appreciating it, it becomes a lot easier.
It sounds like that community grouping at the retreat that you were doing kind of helps too. They've got that support of other women there and your support.
Yes.
I think encouraging women too to really appreciate what their body can do. That helps get them out of like thinking that they have to be in this certain ideal. Do you love how your body feels when it's running? How about when you pick up your kid? Are you glad that you have the strength to do that? And I think really moving into, how the body functions and appreciating that can also be a really good way to get people to appreciate their own bodies. So I'm really hopeful, and I'm so glad that you're out there doing this kind of work. Before we open it up for questions from our audience, please tell our listeners how they can get a hold of you. What are your socials and all of that?
My socials are at Entice Me Soirees, and the best way to get a hold of me probably is through my website, enticeme.com.
Wonderful.
And you can book a complimentary session through there. We do product consultations. We'll hop on Zoom and find you the best product. We'll find what you need to make your life a little bit sexier.
Wonderful. Questions? Anyone? Please come to the mic. Hooray, we have a question.
Got somebody come in.
Hi, so I have trans family members, and I was wondering, do you work with them? Because I've heard that they have, issues with that, with, orgasms.
Yes, I do work with all genders and sexual orientations, and we usually work together with therapists and pelvic floor physical therapists a lot of times with my trans clients.
And are they able to orgasm?
Yes, usually.
Good.
It starts with the self-love piece.
I love it.
Great question. Thank you so much. Anybody else have a question out there?
Okay, well, it looks like we are towards the end of our time with Chief Sexonista, intimacy coach Tiffany Yelverton. We will have all of her website information and her socials available in the podcast description. But we really want to thank you for coming and joining us, Tiffany.
Thank you so much for inviting me and being open to having these conversations, because it's so important.
I agree, and I think we need to have more of them. So hopefully this encourages people to start talking about sex. There is absolutely nothing wrong with it, and this is why we are actually alive. So we should be celebrating that and experimenting and getting to know our bodies better.
I'm a fan of sex personally, even more now that I have talked to Tiffany. Thank you all for being here, and thank you again to Tiffany. Tune in next time to ANEW Body Insight at City Club Los Angeles. We look forward to seeing you next time.
Thank you. Thanks for tuning into the ANEW Body Insight Podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Body Insight Podcast tab. Follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.